Hi, today I am going to share with you my secret of living a healthy and happy life even though I have crossed the age of 50. After a certain age, various health issues such as blood pressure, heart issues, deterioration in bone health, etc. start grappling an individual. A few years ago, I too came to know about a condition accidentally. Yes, accidentally. One fine day, as usual, I was watering the plants in my garden when suddenly I slipped because I lost balance. Even though it was not a major fall, I suffered a fracture in my leg. I thought, how could I suffer a fracture with such a minor fall? When doctor examined me, it was revealed that I had osteoporosis. Osteoporosis is a silent disease which does not reveal itself until you get a fracture. In this condition, the bones become weak and are likely to break. Osteoporosis is characterized by porous bones, low bone mass, bone fragility, and increased susceptibility to fractures. Due to osteoporosis, the risk of fractures increases by 3 to 6-fold among elderly people. Osteoporosis impacts health and quality of life. Increased dependency, pain, anxiety, depression, reduced self-image leads to social isolation, and all these can lead to a poor quality of life. I have osteoporosis, but I use Gemtide. Gemtide is my secret to living a healthy and happy life. Gemtide pre-fill pen device is a ready-to-use device which does not require assembly formation. Gemtide pre-fill pen device contains recombinant human parathyroid hormone which is indicated for the treatment of osteoporosis in men and women. The Gemtide pre-fill pen device comes with an ultra-fine 32-gauge needle that offers a painless experience to the patients. Gemtide pre-fill pen device should be administered as a subcutaneous injection in either thigh or in the lower abdominal area. Unique feature of Gemtide PFS is that it has dose locking at 20 microgram to avoid any dose error and has got inbuilt cartridge, so there is no need of changing any cartridge. Now let's have a look at how to use Gemtide pre-fill pen device or Gemtide PFS. This is the Gemtide pre-fill pen device. This is the cap. These are the needles. Now let me take you through a step-by-step guide on how to use Gemtide pre-fill pen device. Gemtide pre-fill pen device has been designed keeping patients in mind. It is extremely simple and easy to use. Before you begin, wash your hands and wipe the intended area of injection with antiseptic solution. Now follow the steps illustrated ahead to inject Gemtide subcutaneously. Step 1. Hold the Gemtide pre-filled pen device in one hand, then remove the cap by pulling with the other hand. The next step is to attach the pen needle. Take the needle and remove the paper tab from the back of the new pen needle. Holding the Gemtide PFS, fix the pen needle unit on the Gemtide PFS by mounting it at the top pen and keep rotating clockwise. Now with a gentle pull, remove the outer pen needle shield. Save the outer pen needle shield and keep it aside for later use. You will use it to remove the pen needle from the Gemtide PFS once you are done injecting Gemtide. Step 2. Always check the medication flow first before moving ahead. To do so, carefully remove the inner pen needle shield and hold the Gemtide pre-filled pen device with the needle pointing up. Tap the upper body of Gemtide PFS gently with your finger to let air bubbles rise to the top of cartridge. Small bubbles may still remain and will not affect the dose. Check the medication flow by pressing the thumb button fully with the needle pointing upward. Notice if there are drops of medication coming out of the tip of the needle. Step 3. Now let's see how to set the dose to the appropriate unit on the dose scale. Setting the dose is very easy with Gemtite PFS, as it has auto lock on 20 microgram, which is the correct dose of teriparatide. Just you need to rotate the dose dialer in clockwise direction until it gets locked and you can see 20 microgram in the dose window. Now Gemtite pre-filled pen device is ready for injection. Wipe the skin of the area to be injected with an antiseptic swab and let it dry. Hold the pen like this, then place the pen at 90 degree perpendicular to the skin. After the pen needle insertion, push the thumb button inside completely and hold the thumb button down firmly to dispense the dose until it reaches 0 microgram. Keep your thumb button pressed for a few seconds by counting 1 to 10 before removing the Gemtite PFS. This prevents flow back and dripping. This completes the medication procedure. Repeat these steps guidelines every day to take Gemtite. Store the Gemtite pre-filled pen device in the refrigerator door. Never freeze the device. Protect the device from direct sunlight. Follow these guidelines when taking your daily dose of Gemtite with Gemtite pre-filled pen device. Now you can say goodbye to osteoporosis and live a life with vigor with Gemtite. Gemtite pre-filled pen device for building new bones.